Swelling of the chest or breast is common after breast cancer surgery and radiation. Sometimes the swelling is temporary and goes away when someone is done healing, but for others, the swelling can be lymphedema, which can last long term. My name is Kelly. I am a physical therapist that specializes in oncology, rehab, and lymphedema. And in this video, I'm going to explain who is most at risk for getting breast lymphedema and why. And I'm also going to share how we treat and reduce swelling and the lymphedema as well. Before we begin, make sure that you subscribe down below for weekly new videos. You can join us on Instagram for more related content, and you can check out my website for more resources. So after surgery, there's going to be some level of swelling that occurs. It's normal response to surgery, and swelling can take 4 to 6 weeks to decrease. For some, it'll be quicker. For others, the swelling may linger on for a few months, and that can be all normal. We call this post-surgical swelling, and it's usually temporary. For swelling that occurs long-term, this is typically lymphedema of the breast or chest. It's common to hear about the risk of lymphedema in the arm after surgery, but often the breast lymphedema isn't brought up or mentioned as often. So who is most at risk for breast lymphedema? The biggest risk factor for developing lymphedema in the arm is the number of lymph nodes someone has removed. The greater the number, like with a dissection where they take 8 or more lymph nodes, the greater the risk. If someone had less than 5 lymph nodes removed, the risk of getting lymphedema in the arm is less than 5% chance in someone's life. If someone had 8 or more lymph nodes, that number does increase to around 20%. Radiation to this area also increases someone's risk for arm lymphedema a bit more than those other two numbers that we talked about for both just a few lymph nodes and many lymph nodes. But now for breast lymphedema and chest lymphedema, this risk is switched in a way. So the risk is still there for both, but the risk of getting lymphedema in the breast and chest is much higher for those who had radiation compared to those who did not get radiation. So that's the main risk factor. The number of lymph nodes removed still does place someone at a risk, but again, it's the radiation that's the largest risk. So for both the arm and the breast, obesity and higher body mass index or BMI is another risk factor due to the potential of the fatty tissue blocking or clogging the pathways as well. So anyone who has had lymph nodes removed or radiation are at risk, and monitoring for any swelling is really important so that it can be addressed as soon as possible. So what do we want to look for? Any fullness, skin texture changes, which we call pew to orange, which means that it looks like a peel of an orange. We are feeling for any pitting, which is when the tissues stay indented when we press on it, or the area may be firm and full. Someone with swelling of the breast may explain that they feel heavy or aching or the breast feels painful. And they may notice that clothes fit differently on that side compared to the opposite side. Swelling may even wrap around to the side of the chest and even into the back. So women and men notice that their arm doesn't rest against the side of their body as well as the other side, and that might be their sign as well. First, we always want to make sure that someone doesn't have an infection. So if someone has swelling, pain, redness, and the breast is hot to touch, then he or she should urgently reach out to a doctor or seek medical attention. Someone may also have a pocket of swelling that's usually near the incision area or the surgical area after surgery, and this can be what is called a seroma. This isn't lymphedema, and some go away on their own or with light therapy or compression therapy, but if not, then some are also drained by the surgeon. Now, if cleared for safety or any safety concerns, then there are some treatment options for breast lymphedema and swelling. Some need to wait until all cancer treatment is done, and some don't, so always please work with your doctor and therapist for more guidance. But I'm going to briefly talk about the various treatment options here. There are 4 main treatment options to help reduce and manage breast lymphedema. Along with these, there are other ways and specific tools that someone can use to help reduce swelling and pain. So let's go through a few in a moment, but if you're looking for more options and want to go a lot more in depth than what I'm sharing in here today, and you want to learn step-by-step techniques and guidance, then you'll definitely want to check out my breast cancer rehab program. As an oncology physical therapist, I work with individuals daily to improve their symptoms and the side effects that cancer leaves behind so that they can get back to focusing on what's most important in life. There are different modules or sections that you can learn at your own pace, starting with the time of diagnosis and going well into years or decades after treatment's over. In the program, we go through lymphedema risk of the arm and the breast and the chest, shoulder range of motion, pain, tightness, exercises, and more. Someone can choose a piece of the program if they only need access to one of those sections, or you can get the entire program as well. So if you're looking for more information on that, you can find that at my website at cancerrehab.com, which I'll link in the description box down below, as well as up above. But for now, let's go into a few treatment options. So first, lymphatic drainage. Lymphatic drainage is the main treatment of lymphedema of the breast. Lymphatic drainage is a massage-like technique that is done in a specific sequence with a special technique to move fluid out of a congested area to reduce the fluid. This will also help improve someone's skin texture and help avoid infections. A certified lymphedema therapist can perform this, but it may be something that you also need to learn to do at home long term. In the module I talked about, I go through step by step on how to exactly do that someone can visually follow along with. The next treatment option is compression. So compression is a well-known form of treatment for swelling lymphedema in the arm and the legs, but it is also used to support the chest and the breast in the same way. By giving gentle compression to the chest and the areas of swelling, it can help reduce the volume and the fluid in the area, which can also help reduce the pain. So a standard compression option is with a compression bra. So a compression bra looks like a sports bra, but they are made specifically for lymphedema. So this is one option from Prairie Wear. Prairie Wear has a wonderful line of compression bras that come in a large range of sizes and ability to adjust. They have removable cups so it can be worn to shape someone. So if they had a mastectomy, it will lay flat against their chest, or cups for someone's shape. They also are high and wide on the sides to help really support some of those areas that are stubborn and hard to reach with other types of bras. They have adjustable straps. They are higher and more full coverage throughout as well as in the back. And they just have different options on their website, but this is their most full coverage bra. This is their Prima bra. Another option with that is a swell spot or a swell insert. So this gives some compression as well to the chest. This is a breast piece that wraps around the side of the body. And this can go inside the compression bra, or it can go into a tank top or shirt that is snug, something that's going to help push against the skin. It has chipped foam inside for a gentle way to help to soften the skin for any hardening or thickening from fibrosis, which can occur because of lymphedema and fluid that sits there too long, or it can be due to radiation as well. So they come in various shapes and sizes. This is just one of the many. I will put a lot of links in the description box down below that you can find to just look at different ones that are specific for the breast and then the side of the body, or maybe it's just a smaller piece or a smaller round one if someone has a localized swelling. So a lot of options, but I will link those down below as well. Now, exercise is another important treatment option for breast and chest lymphedema. We know that the muscles in the body act as a pump to the lymphatic system, and this can help work to move fluid out of an area that is congested. Exercise is best done with the compression on to be the most effective for lymphedema, but it can be done with or without. I give more exercise ideas and options in the program, but at the end of the day, any movement is going to be beneficial, and something is always better than nothing. Like I mentioned, there are a lot more treatment options that we aren't going to get into in this video, but these are the main types. You can check out my other resources on all of my other channels and my other videos if you want to dig deeper into ways to treat and manage breast lymphedema or any other topics related to breast cancer recovery or rehab. I hope you all found this video helpful, and we'll see you all in the next video. Thanks, everyone.